ನಮಸ್ಕಾರ. ನ್ಯೂಸ್ 26ಗೆ ಸ್ವಾಗತ.
ಟಾಟಾ ಆಡಿಟೋರಿಯಂನ ಕಾಂಪ್ಲೆಕ್ಸ್ನಲ್ಲಿ ನಡೆಯಲಿರುವ ಕಾಂಗ್ರೆಸ್ ಉದ್ಘಾಟನಾ ಸಮಾರಂಭದಲ್ಲಿ ಮುಖ್ಯ ಅತಿಥಿಗಳಾಗಿ ಬೆಂಗಳೂರಿನ ಐಐಎಸ್ಸಿ ನಿರ್ದೇಶಕ ಪ್ರೊ ಗೋವಿಂದನ್ ರಂಗರಾಜನ್ ಮತ್ತು ಡೆಲಾಯ್ಸ್ ಸೌತ್ ಏಷ್ಯಾದ ಸಿಇಒ ರೋಮಲ್ ಶೆಟ್ಟಿಯವರು ಸೆಪ್ಟೆಂಬರ್ 25ರಂದು ಭಾಗವಹಿಸಲಿದ್ದಾರೆ.
I have the president of the International Society for the Study of Hypertension, Professor Anne Mary, who has come all the way from Australia. We have Dr. Sarosh Rana, who is from USA and who has done a lot of work on how we can prevent this preeclampsia from occurring and causing problems. And of course, we have our very own Dr. Revati Rajan, who has helped me and helped us all in arranging this kind of a publicity going out to the community, that please don't ignore certain symptoms you have: swelling of the legs, decreased urine coming out, okay, swelling of the face, pain in the abdomen. So many things happen. And we treat patients who come to us, but you have a larger reach. People just read whatever you have written and they may pick up one or two sentences out of it. And even if from one paper, if one life is saved, I think it's definitely worth it. Okay, and to tell their experience, we have got two patients here.
ನಾವಿಬ್ರು ಮನೆಯಿಂದ ಸುಮ್ಮನೆ ಕ್ಯಾಶುಯಲ್ ಆಗಿ OPD ಚೆಕಪ್ ಬಂದ್ವಿ. ಬಂದ ತಕ್ಷಣ ಮೇಡಮ್ ಚೆಕ್ ಮಾಡಿ, ನೋಡಿ ನಿಮಗೆ BP ಲೆವೆಲ್ ಎಲ್ಲ ಕರೆಕ್ಟ್ ಇದೆ, ಮತ್ತೆ ಈ ತರ ಸಮಸ್ಯೆ ಆಗ್ತಾ ಇದೆ, ಇಮಿಡಿಯೇಟ್ ಆಗಿ ನೀವು ಅಡ್ಮಿಟ್ ಆಗಬೇಕು, ನಾಳೆನೇ ಸಿಸೇರಿಯನ್ ಮಾಡಿ ಡೆಲಿವರಿ ಮಾಡಬೇಕು ಅಂತ ಹೇಳಿದ್ರು. ನಮಗೆ ಒಂಥರ, ಯಾಕಂದ್ರೆ ನಾವು ಏನೋ ಸುಮ್ಮನೆ ಇಬ್ಬರೇ ಬಂದಿದ್ವಿ ಚೆಕಪ್ಗೆ. ಮೇಡಮ್ ಹೇಳಿದ ತಕ್ಷಣ ನಾವು ಇಬ್ರು ಏನ್ ಮಾಡೋದು ಈಗ, ಮೇಡಮ್ ಹೇಳ್ತಾ ಇದಾರಲ್ಲ ಅಂತ ಮಾತಾಡ್ಕೊಂಡ್ವಿ. ನಾವು ಆಯ್ತು ಮೇಡಮ್, ನೀವು ಹೆಂಗ್ ಹೇಳಿದ್ರೆ ಹಂಗೆ ಕೇಳ್ತೀವಿ. ನಮ್ಗೆ ನಾನು ರಿಕ್ವೆಸ್ಟ್ ಮಾಡ್ಕೊಳ್ಳೋದೇನಂದ್ರೆ, ಒಬ್ಬ ಡಾಕ್ಟರ್ ಏನ್ ಅಡ್ವೈಸ್ ಮಾಡ್ತಾರೆ ಆ ಅಡ್ವೈಸ್ ಪ್ರಕಾರ ನಾವು ಫ್ರಮ್ ಬಿಗಿನಿಂಗ್ ಫಸ್ಟ್ ಡೇ ಇಂದ ಡೆಲಿವರಿ ಆಗೋವರೆಗೂ ಅವ್ರ ಅಡ್ವೈಸ್ ತಗೊಂಡ್ರೆ, ಸೈನ್ಸ್ ತುಂಬಾ ಮುಂದುವರೆದಿದೆ. ಇವತ್ತು ಪ್ರತಿಯೊಂದು ಸಕ್ಸಸ್ ಆಗ್ಬೇಕಂದ್ರೆ ಬಿಕಾಸ್ ಆಫ್ ಸೈನ್ಸ್. ಎಲ್ಲರೂ ನಾವು ಮಗು ಮಾಡ್ಕೋಬೇಕಂದ್ರೆ ಡಾಕ್ಟರ್ ಅಡ್ವೈಸ್ ತಗೋಬೇಕು. ಸೈಂಟಿಫಿಕ್ ಆಗಿ ನಾವು ಥಿಂಕ್ ಮಾಡಿದ್ರೆ ಖಂಡಿತ ಪ್ರತಿಯೊಬ್ಬರು ಈಗ ಬಗೆತನದಿಂದ ಬಳತಕ್ಕಂಥ ಹೆಣ್ಮಕ್ಳು ಮಗು ಪಡ್ಕೊಳ್ಳೋದಕ್ಕೆ ಅವಕಾಶ ಇದೆ. ಸೈನ್ಸ್ ನ ನಂಬಬೇಕು, ಸೈಂಟಿಫಿಕ್ ಆಗಿ ಥಿಂಕ್ ಮಾಡಬೇಕು, ಡಾಕ್ಟರ್ ಅಡ್ವೈಸ್ ತಗೋಬೇಕು ಅಂತ ಹೇಳಿ ನನ್ನ ಮಾತನ್ನ ಮುಗಿಸ್ತೀನಿ.
ಅಪ್ಡೇಟ್ ಮಾಡಿದ್ದಾರೆ. ನಾವೇನ್ ಹೇಳ್ತಾ ಇದೀವಿ ಅಂತಂದ್ರೆ, ಈ ಬ್ಲಡ್ ಪ್ರೆಷರ್ ಪ್ರಾಬ್ಲಮ್ ಇಂದ ಅಂತಂದ್ರೆ, ಬ್ಲಡ್ ಪ್ರೆಷರ್ ಒಂದು ಲೆವೆಲ್ಗಿಂತ ಜಾಸ್ತಿ ಆಗೋದ್ರಿಂದ ಎಷ್ಟೋ ಜನಕ್ಕೆ ಗೊತ್ತೇ ಆಗೋದಿಲ್ಲ. ಸಡನ್ ಆಗಿ ಇವಾಗ ಪ್ರೆಗ್ನೆನ್ಸಿ ಅನ್ನೋ ಸ್ಟೇಜ್, ಗರ್ಭಿಣಿಯರಲ್ಲಿ ಸಡನ್ ಆಗಿ ಬ್ಲಡ್ ಪ್ರೆಷರ್ ಜಾಸ್ತಿ ಆಗೋದ್ರಿಂದ ಈ ತರ ತೊಂದರೆ, ಈ ಪ್ರಿಯಕ್ಲಾಂಪ್ಸಿಯಾ ಅಂತ ಏನ್ ಕರಿತೀವೋ, ಇದು ಆದಾಗ ಅಮ್ಮನಿಗೆ ಮತ್ತೆ ಮಗುಗೆ ಇಮಿಡಿಯೇಟ್ಲಿ ತೊಂದರೆ ಆಗೋ ಚಾನ್ಸಸ್ ಇರುತ್ತೆ. ಬಟ್ ಇಂಥ ಒಂದು ತೊಂದರೆ ಆಗುತ್ತೆ ಅಂತ ನಮಗೆ ಗೊತ್ತಾಗಬೇಕು ಅಂತಂದ್ರೆ, ನಾವು ಅವ್ರಿಗೆ ರೆಗ್ಯುಲರ್ ಆಗಿ ಬ್ಲಡ್ ಪ್ರೆಷರ್ ಚೆಕ್ ಮಾಡಬೇಕು, ಬ್ಲಡ್ ಟೆಸ್ಟ್ ಮಾಡಬೇಕು. ಅದಕ್ಕೆ ಅವ್ರು ರೆಗ್ಯುಲರ್ ಆಗಿ ಆಂಟಿನೇಟಲ್ ಕೇರ್ ಅಂದ್ರೆ ಗರ್ಭಿಣಿಯನ್ನ ನಾವು ಏನು ಎಕ್ಸಾಮಿನ್ ಮಾಡ್ತೀವೋ ಅಂತ ಕೇರ್ಗೆ ಅದೇ ಪರೀಕ್ಷೆಗೆ ಬರಬೇಕು. ನಮ್ಮ ದೇಶದಲ್ಲಿ ಏನಾಗಿದೆ ಅಂದ್ರೆ, ಇವಾಗ ಸಿಟೀಸ್ ಅಲ್ಲಿ ಎಲ್ಲರೂ ಬರ್ತಾ ಇದ್ದಾರೆ, ಬಟ್ ವಿಲೇಜಸ್ ಅಂದ್ರೆ ನಾವು ಹಳ್ಳಿಗಳಿಗೆ ಹೋದ್ರೆ ಈ ತರ ಕೇರ್ ಸಿಗ್ತಾ ಇಲ್ಲ. ಬಟ್ ಈ ಪ್ರಾಬ್ಲಮ್ ಏನಾಗ್ತಾ ಇದೆಯೋ ಅದು ಸಿಟೀಸಲ್ಲೂ ಆಗುತ್ತೆ, ಹಳ್ಳಿಗಳಲ್ಲೂ ಆಗುತ್ತೆ. ಸೊ ಅದಕ್ಕೆ ನಾವು ಏನಂತ ಹೇಳ್ತಾ ಇದೀವಿ ಅಂದ್ರೆ, ಎಜುಕೇಶನ್ ತುಂಬಾ ಇಂಪಾರ್ಟೆಂಟ್. ಬರೀ ಡಾಕ್ಟರ್ಸ್ ಮತ್ತೆ ಸ್ಪೆಷಲಿಸ್ಟ್ ಅಲ್ಲ, ಪೇಷಂಟ್ಸ್ಗೂ ಎಜುಕೇಟ್ ಮಾಡಬೇಕು. ಪ್ರೈಮರಿ ಹೆಲ್ತ್ ಕೇರ್ ಫಿಸಿಷಿಯನ್ಸ್ ಅಂತಂದ್ರೆ, ಇವಾಗ PhD that Ramanamma went through, it's been about 8 years. She can share her experience in Kannada. She is Ramanamma case ಬಗ್ಗೆ ಹೇಳ್ಬೋದಮ್ಮ. She is a case of a difficult problem called Graves' disease, where there is thyroid dysfunction, and she also has complex autoimmune problems, which again predisposes to HELLP. HELLP is an autoimmune condition where the immunity in the body is directed for the wrong reasons. So she actually ended up, she was an elderly lady who conceived at around 38-39 years of age, and she went through this, but we battled it for her, and we battled it together, and her baby is doing really well at 8 years of age. So ನಿಮ್ಮ ಎಕ್ಸ್ಪೀರಿಯನ್ಸು ನೀವೇನು ಹೇಳಬೇಕು ಅಂತ ಇದ್ದೀರಾ ಸೊಸೈಟಿಗೆ, ಈ ಥರ ಸ್ವಲ್ಪ in India now the women getting pregnant at a higher age is increasing immensely. We're finding women who are getting pregnant, at 35 and more very commonly. So it is so important that we actually build awareness of preeclampsia in them. And that's what Ramanamma wants to do to you. So Ramanamma, ನಿಮ್ಮ ಏಜಲ್ಲಿ ಆ ಥರ pregnancy ಆದಮೇಲೆ ಏನೇನು ಪ್ರಾಬ್ಲಮ್ಸ್ ಆಯಿತು?
I think that's one of the saddest things that you can imagine. I've seen many women who are so scared that they won't have the second child in their family. So not only is the pregnancy and their plans and the scariness of the preeclampsia event affected, but so frightened that their plans to have a second or third child have been influenced. So I think there are some of the hidden messages in this, that we see lonely children and as Professor Mehta said, children that are born extremely early or premature for their normal dates have a whole lot of complications. That can include cerebral palsy and blindness and deafness related to being born very little, very early and very small, because this disease is a scourge and their blood pressure goes very high, and we sometimes have no choice but to deliver the mum, bail out of the pregnancy so that the timing is safe, but then are left with supporting a very little baby if they do survive these dreadful events. All of us who've worked in this area have stood at the bedside as some mother who's swollen from preeclampsia suddenly starts to have a fit, and that absolutely strikes fear into the hearts of the nurses and the doctors and the family.
I actually did my training here in Aligarh, and then for several years I'm in Chicago. I'm a professor at the University of Chicago. So I do see a lot of patients again. I don't think I've seen 15,000 patients with preeclampsia. So I take care of women who have different risk factors. So what problem you're talking about is sometimes when you're pregnant, you can have some high risk factors. So some women are a little bit older, or if you have high blood pressures before you get pregnant. At least in my patient population, we have patients who have kidney disease, you can have people who have transplants. That increases your risk to have something called preeclampsia, which is this high blood pressure problem, happens towards the end of the pregnancy and can lead to really bad maternal outcomes. So essentially it's a problem, a disease that can affect the mom, literally all organ systems. So it can affect your brain, so people can have seizures, it can affect your lungs. A common problem in our mothers we see is they can develop fluid in their lungs, they can have, their liver can fail, their kidneys can fail. So it's kind of a multi-system organ dysfunction that can eventually also lead to maternal death. So preeclampsia is a very
by age now 39. Actually, I had a pregnancy, like 5 of my pregnancy was miscarriages. I was not able to know the reason, for what reason I had those miscarriages. When I came to doctor, I came here to the doctor with edema, with my swelling in my legs, hands, face and all those things. Then I was admitted here in ICU. Then once the doctor came to me and he asked me what was the reason, because before I was not able to know about Prakash Mehta here in Jain Hospital. Later on I came to know all the 5 pregnancy was due to my hypertension. Like 7 months my baby will be fine. After 7 months I got, all of a sudden I get my BP high. Then my baby got, like it was aborted. Then after that